what about that? When you talk, you said epidermis. What about the epidermis?
It protects the body. I don't know, it's a covering. Protect you from infection.
Protect you from infection?
Yes, unless there's a break in the skin.
Okay.
Unless there's a break in the epidermis, it protects you from
Carry
infection.
the skin itself, regardless of the layers. But the epidermis is the first.
First.
What else?
What else?
Come on, guys, what else?
Temperature.
Okay, temperature, regulation.
Regulation.
Anything else?
The largest organ.
All right, okay, remember we're talking now about pathophysiology. Yesterday we did anatomy and physiology. So today we want to look at what diseases can occur with the skin that you know of, that you've done. Because this is a review of what you've done before. All right, so let's start.
Pimple,
Me-
redness.
What about
Pimples.
melanoma? Melanoma.
Eczema.
Skin cancer.
Cancer.
Melanoma.
Melanoma.
Yeah.
All right, so if you have pimples, and also when you're sitting to talk on discussions and you say something, you must understand what's the rationale. Why? And if they have a disease condition, first thing you have to understand is what is your role. So if a person says, I got pimples, who will you be talking to?
Dermatologist.
No. Who you, in the common, without medical persons? Teenagers more likely, right? And so in she said they have pimples. What would you tell this teenager? Why you tell-
Hormonal
why you
changes,
said-
hormonal
You
changes.
said hormonal changes. I don't understand what you mean by hormonal changes. Why you tell me hormonal changes?
Puberty.
So look the word pimple and see what pimple tells you.
A pimple is a kind of comedo. What does comedo mean?
What?
Comedo is a technical term for blackhead that results from excess sebum and dead skin cells getting trapped in the pores of the skin.
Right? So pimples has nothing to do with hormones. All right, guys? So sometimes you gotta understand what it is before you can go and do patient teaching or talking to groups or whatever you're talking about. All right? So right away, you know, pimples, we consider like blackheads. And why? It means that the sebaceous gland has been
Clogged.
what?
Clogged.
Clogged. You remember sebaceous gland secretes what?
Sebum.
Sebum, which is an oily substance. It gets clogged up. And that's going to bring us to know what is a boil.
So pimple and acne, they are two different things, right?
Are we going to come to?
Okay.
And what so?
What is a boil?
The
I
boil
think
I'm
is
asking-
filled
I
with
think a-
filled bumps that forms on the skin when bacteria in.
A boil
Infected.
is, people say I got a boil, I got to pop my boil. Right? You have people say I'm going to pop the boil, I got to take that boil off. But what is a boil?
Dead.
A boil is an infected follicle.
follicle.
Yeah.
That's all a boil is, an infected follicle. But people will be like, I got pop my boil, I got something going on under my skin, and no. So you gotta know the basic stuff, understand the basic stuff, so you can really talk to your patients. So now you understand
Warts,
pimple,
blister, hives.
what's a boil. And then the most common thing that happens to teenagers is acne. What is acne?
What does that mean?
See what's acne.
I think that's something with the hormone changes.
Is this skin condition that occur when your follicles become clogged with oil? In the
There you
skin?
go. Same follicles, right? One, the follicles for the boils is what? Infected by microorganisms. But when you have a pimple and you have acne, it means you have what? Blocking. Look, it's right there. It's right in front of you. And that's why you have all of these acne what? Wash, right? They give you these different things for the kids to do with their face. But the thing is, a lot of people think it's only the face. You could get acne other parts of the body. But why the focus is on the face? Because it's the face which is presented out to the world. And the little teenagers, they want to, well, especially the little boys and girls, they don't want the opposite sex to look at them and like, oh my God, you look horrible. You know, they're now growing up and they don't want to be in those sort of situations, okay? So basically you want to tell them about face wash, things you're going to do. All right, so you understand what that is. Now, let's look at other things that you can see on the skin. What else can you see on the skin?
Rash.
A rash. But rash could mean anything. Underlying cause for a rash. So just look at the word rash itself.
A rash is a change of the human skin which affects its color, appearance, or texture. It may be localized to one part of the body or affect the entire skin.
But is rash a separate entity? Or is it something that manifests itself because of a process?
Yes.
I could get a rash from contact dermatitis. I could get a rash from allergies. All right?
Or
I
like
could
a
get a
di-
rash from different things, right?
or even a diaper rash.
There you go, diaper rash. You get a rash of everything.
Heat rash.
But then, right? But then you got, as I said before, know what is the underlying cause, because that's now when you do your treatment, it is based on what? The underlying cause. And when I say when you do your treatment, remember you'll be doing nursing management, not medical.
You know if internet is coming?
Because your nursing management will start with what? Informal care plan, which is start in your head, to your formal care plan that you have to put in writing. And if you don't know what the problem is, how are you going to come up with a nursing diagnosis? How are you going to say what is your goal? What's your intervention? Okay? All right, so let's look at some other things that can happen. You can have a rash. You can have a swelling, right? A rash with a swelling. Or a rash with a redness. So let's look at urticaria.
How you spell that?
urticara.
And be a chronic, acute or chronic spontaneous, a wheal, a superficial skin color, or pale skin swelling.
So you have this swelling, or as I said, a wheal. And the wheal is spelled W-E-A-L, not W-H-E-E-L. So you have a wheal, you have this swelling, all right? And this can be spontaneous. What I want you to do though first is to look at an image of urticaria or wheal, or hives as they want to call it. Any one of those you want to use, you can use.
Hives.
Right.
All kinds of colors.
But I want you to look at an image.
Look at it. 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 Look at it.
Wow.
You can have allergic reaction, right?
Yep.
What is hives?
It's the same thing.
Before you even go looking for it, what you think hives is? Yeah, we know it. Definitely a rash, but remember we go with the underlying cause.
A reaction.
Like from the medication or allergy?
It's the same thing.
Shellfish or-
Yeah, touch my poison ivy.
Poison, contact with something that's not there. Now look for the cause of hives.
It says that it's
Usually
often.
in America, it's always when the kids run in the bush and you get in touch with those poison ivies and all that stuff. But look at hives, please.
It said it's often caused with it's often associated with severe itching.
Absolutely, that's a manifestation cause. What we look at is cause.
Allergic reaction, trigger.
Hypersensitivity or a little yep.
Emotional stress.
Certain medications.
Oh, that's what we pick first one. Emotional stress. So a person who's going through emotional situations, they can have a reaction in their skin. It may sound weird, right?
No, it happened.
But it does happen. And don't mean that something had to be an allergy. Anxiety is a messed up thing. When people are anxious, they end up doing a lot of stupid stuff. And some of it they cannot control. And that's what you gotta remember. Alright? Now you're gonna have allergies. Stinging nettles. You know stinging nettles? Those plants, they touch you, and then next you have all that stuff happening to you. Alright? So during the summertime, there's a time that you really want to be talking to who? The kids.
Children.
And the people who like to go out into the wooded areas to do their walks and all that sort of nice stuff. Okay? But you also want to talk to people who have episodes of anxiety and they may see things appear in their skin. Okay, so that's urticaria. So you did a couple of things, pimples, boils, acne, urticaria. What else you think you can see?
In the skin.
Dry skin?
Dry skin. And what's dry skin? What's the medical name for dry skin? Come on, what's the medical name for dry skin?
Not eczema.
No, it's an X word.
I can't remember. I could see it.
Cirrhosis. Xerosis. Cirrhosis is related to dry skin. Then the question is, if a person have dry skin, why they have the dry skin? That's your be a problem.
It might be dehydrated.
Why they have the dehydration? Okay? If a person becomes dehydrated, what caused them to become dehydrated?
They don't drink enough water.
They don't drink enough. Why they don't drink enough water?
Like the elderly, their memory, they forget.
The elderly forget. So now we jump into dementia. We got short-term memory problems.
Some of them just.
But that's
Young
all.
people
That's a
who don't
geriatrics. If you do geriatrics, what else can cause a person's skin to get dry?
Environmental factor.
Environmental. You walk out there and you're walking in the sun all day. You're drinking nothing. That's a common situation, right? What else can get a person to become dry? Do you know you drought in the house in the winter time?
Yeah.
Do you know how many times you get up at night to drink water? Why? Because you're being cooked. The heat in your house
Right.
is cooking you, and as you get up and you go out, or you ask keep some water by the bedside or something of the sort, because the heat is not normal. So that's going to dry, and that can cause cirrhosis. But just understand, cirrhosis is drying of the skin, and then if it's an environmental situation, you have to use what? Moisturizers. You're putting moisturizer on the skin. The person just having a dry skin.
Mm-hmm.
They're not having dehydration, just a dry skin. Because if they're having dehydration, we're going to go to hypovolemic volume and all that sort of stuff. And we're not going there. We're just going with the skin. What's happening to the skin? The skin is getting dry, so you need to have what? What do they use in the facilities, in the healthcare facilities? What do you put in your patients? In the ointment.
For skin,
Mm-hmm.
some cheap lotion.
What else?
Synthetic lotion.
Whatever lotion they have, right?
Yeah.
They give you lotion. Don't mix up moisturizing lotion with skin barriers,
Okay.
right? Because it has the what?
Oil.
It is not water based, it's oil based. And with the oil based, it now becomes a what? A barrier.
Mm-hmm.
And especially when you use it in the perineum or perineal area, that's where you use the skin barriers. But for the skin, when it's dry, water based. Okay, water based. You can put out the nice stuff, fancy stuff on your skin afterwards, but get your water based because that's what your skin wants to prevent cirrhosis. Alright? What next we go to? Let's look at
Skin
something
turbo,
else.
like skin turbo, like using the.
Alright, skin turgor is related to dehydration. Alright, we're now going to dehydration. So let's take on the skin.
Skin cancer.
Cancer of the skin. Cancer of the skin is related to most times what? Carcinoma based on exposure to the skin. And what's that thing that protects the skin? No. What your body, your natural protection. What protects you?
Vitamin E.
D.
Vitamin
Clothes.
E. No.
Find the color of your skin. Melatonin.
Oh, melanin.
Melanin.
Oh,
Melanin.
look it up, please. Look it up, please.
Melanin.
Melanin, not melatonin. Melatonin is going about Alright, so look for melanin, please. Melanin, or however you want to pronounce it, but find out one that is.
Melanin is extremely efficient in absorbing UVB radiation. Thus, decreased skin pigmentation markedly reduces vitamin D synthesis, as does the use of sunscreens.
Okay.
Go once again, read it.
Again? Okay. Melanin is extremely efficient in absorbing UVB radiation.
That's ultraviolet light. That's
Thus-
coming from the sun.
Thus, decreased skin pigmentation markedly reduces vitamin D synthesis, as does the use of sunscreens.
That is, you would not find people who have darker skin color having skin cancer. You will have, you can have, but the most of the people who get skin cancer are of light, very clear, light-skinned people. All right, so let's ask the question. Ask Google the question. Does this melanin protect against skin cancer? Ask the question.
Does melanin protect against skin cancer?
Nine.com. Melanin is a protective pigment in skin, blocking UV radiation from damaging DNA and potentially causing skin cancer.
There you go, full stop. That melanin that you have in your skin protects you from skin cancer. Why is it people who are light skinned, like this young lady here and this young lady here, they should be using a lot of what?
Sunscreen.
Sunscreen. So that they don't have that protecting factor. Right? That's why the
Maybe that's
people in
why I like
Africa
dark
are
skin
what?
so much.
Black. And the people who are in Europe is light
You go
skin.
tanning a lot?
Okay?
Let me are they closer to the equator, people in Africa?
If they're close, there are many people who are close to the equator. But not all the countries are
It
close
doesn't
to
have
the
anything
equator.
to do with that, right?
the equator has a lot to do with tropical countries,
Okay.
right? That's why when you're talking about the equator, you're talking about countries which are tropical and then countries which are temperate. United States is a temperate country, right? Okay. So you know we have the natural protection. Now you were talking just now about the artificial protection, which is the use of sunscreens.
Oh, okay.
All right, that's the artificial protection. All right, so now let's go a little more into the skin. And guys, as we go along, remember we're discussing, and when we're discussing, it's for you to understand, not for you to memorize. Just understand what I'm saying? All right, now, we have boils that come up, we talk about pimples that come up, and we have some real little other little things that come up on the body. Things such as carbuncle. See the word carbuncle. C-A-R-B-U-N-C-L-E. Carbuncle.
Carbuncle is carbuncle and boils together, the same thing. It says a painful pus-filled form on the skin when bacteria infected and inflame one or most of the hair
It's
follicles.
different though.
A carbuncle is a cluster of boils.
Right. Now take carbuncle and compare to furuncle. F-U-R-U-N-C-L-E. Carbuncle and furuncle. I suggest you sit on next to her so you can see your laptop. Or go to go over there to somebody, you have a laptop over there, right?
Furuncle. Let's look that up.
Why is it furuncle?
I'll get a good definition.
Furuncle is a pus-filled boil under the skin. You hear this word boil all the time, right? But with a different name. And then you hear when a whole set of them get together, you become carbuncle. All right?
Furuncle,
Guys,
F-U-N-C-L-E.
L-E, furuncle.
It's a boil.
Yes, furuncle is
acne.
an infected boil. So you see the carbuncles, the furuncles, right? So those are all things that has something inside of it. Basically, everything we've been talking about has something in it, right? With acne, pimple, furuncle, boil, whatever, it has something inside of it. Right? And what is pus?
Dead blood cells.
No, I don't want to hear that. You gotta talk better than that. You guys are RNs. What, don't tell me, what is pus?
That's it.
Pus is a thick yellowish or greenish opaque.
But what is pus made up of?
That's a dead erythrocyte?
Dead blood, white blood cells.
Dead white blood cells.
Okay.
No, don't say blood cells. Because you have two other types of blood
Dead
cells.
white blood cell, maybe you didn't hear me.
Oh, okay, maybe I didn't hear. Because I hear
Yeah.
blood cells.
No.
All the thing you gotta be, I don't want you to tell me white blood cell either.
Dead.
I want you to tell me leukocytes.
Oh, leukocytes.
Dead.
Leukocytes or lymphocytes. Tell me that, and I'm gonna be with you.
It
Tell
says,
me other stuff, I'm learning something that I don't wanna learn. That is the
White
normal
dead
situation.
cells?
it says here that
White blood dead cells are leukocytes.
it
And the
says,
leukocytes are breaking up into your macrophages and what have you. I'm not even gonna go into that, but because you're supposed to know that, right?
I
Yes.
was gonna add this.
What's that?
It contains both living and dead bacteria.
Of course,
As
absolutely.
well.
Because why they go there? Why did the cells go to a place? Why does your white blood cells, as you call them, which is the leukocytes, why does it go somewhere?
To fight off the bacteria
Because you had an invasion.
infection.
It's like Russia invade Ukraine, and you find all them other countries are sending stuff to help out, right? In your body, you have microorganisms invaded. So when the microorganisms invaded, the body now send a whole set of what? Leukocytes or white blood cells. And when they're fighting, they die. And when they die, that's the pus. And then because they're dying, while they're killing, you're going to find what? Dead bacteria. Because they're killing the bacteria. That's their job. They can kill the bacteria by something called what? When it's surrounded and engulf the bacteria. Phagocytosis.
Phagocytosis.
Phagocyte.
Phagocytosis.
Phagocytosis.
Cytosis.
Phagocytosis. Wow. Good. So look it up, please. Phagocytosis. Let's see what it is.
Phagocytosis.
Or if you want, you just look for see what's a phagocyte.
Look up phagocytosis. Phagocytosis is the process by which certain cells engulf and consume foreign material and cell debris.
All right. They don't just walk up and punch and thing. They're going to surround you. And then they take over. They engulf them. Okay? No, that's the type of bacteria. That's just a bacteria. That's just the type of the white blood cells. Then you have your macrophages, which is the one that's going to attack every day. Then your leukocytes, your lymphocytes, which is your memory cells. But we're not doing that right now. We're doing skin. All right? But we know everything's connected in the body. So we have this purulent stuff inside of these areas that we spoke about. All right? So let's look at one that has a lot of purulent stuff inside. And what you think could have a lot of purulent stuff? Why do you think could have a lot of purulent stuff? Abscess. An abscess. A whole lot of purulent stuff, all right? So look up the word abscess. What's an abscess is?
ABCESS.
Abscess is a collection of pus that has built up within the tissues of the body.
There you go. A whole lot of collection. But the thing is, how do we take care of that situation? Usually we do incision and drainage. Right? Incision. We gotta get that stuff out. Right? It is not like the regular balls that you get. This is accumulation of a whole lot. So you have to drain it out. Alright? The body can't carry away those wastes. Are you guys understanding? Alright. So let's move on from the things that has a lot of stuff inside of it. But before we move from there, most of these stuff that we just talked about, the ones that contains things inside, if they're nursing diagnosis will be things like body image disturbance, because like the person don't want to see stuff in their face, right? Then another nursing diagnosis will be alteration in comfort related to pain, like abscess. Got an abscess and you don't know where you get it, there's a lot of pain, right?
And then
We could get ineffective thermoregulation, which is patient getting fever because of infections. Because anytime you have something that have white blood cells running to go there, infection is occurring. And how you know that sometimes an infection is occurring? You have something called what? Your CBC, your complete blood count, and your complete blood count, you're going to look for WBC. And then you see the white blood cell count is high. It means that the body starts to produce because there's an infection. You guys with me?
Yes.
Okay. Now let's look at something that can happen. Now, we talk about other things like the environment and the stinging nettles and how poison IVs and anxiety, that sort of stuff. Now, let's talk about this. You get hit. If you get hit, and how can persons get hit? You can get hit from a motor vehicle accident, right? You can walk and fall. You can have somebody punch you, slap you, kick you, do whatever it is, right? But what we're looking at is what is the effect, the impact on the skin. Now, as registered nurses, you don't just go writing and documenting things just like that. When you document, you have to ensure that it is factual because it is a legal document. And if they have to call you up, but sometimes it may be like 20 years later, when they call you up to go to court. And trust me, that's happened. And when you go to court because of the situation, you gotta, if you look at the note, you say, I can't remember writing that graph. But you wrote it back then. Right? A lot of nurses don't remember because you got so many notes you write. That's why you have to ensure that your note, your document is accurate and factual. Because the lawyer on the other side is the one who's going to be perusing. And you know who the lawyer gets his information from? Who's perusing all this stuff? Nurses, legal nurses. Nurses who do the legal nurse course, to get this certification, they work with the lawyers. And they review all your notes and they pick out the, oh, she didn't do this, or she did that. It's a nurse who tells the lawyer what you need to do with that and how to present it, believe it or not. Right? So you want to ensure that your documentation is factual. And when we talk about factual, you have to have EBP, which is evidence-based practice. And your evidence-based practice is based on fact. And this fact that you have is now related to your CT, critical thinking. Because you cannot make decisions without what? Critical thinking. Every decision you make as a nurse is based on critical thinking. The facts is presented to you. And everything has to be objective and not subjective, how you feel. It's not how you feel, it's what you have in front of you. And that's what you're working with. So if one comes and says, oh, you know what? Mr. West is a damn fool. It's a damn, Mr. West is a damn fool. Why are you saying he's a damn fool? Because I see him the other day and he walk in and he look like he got on his shoes for his foot. Something must be wrong with that man. No, you gonna write that down. You didn't see nothing. You hear nothing. I might have taken off my shoes because I didn't have problems about the size 8 shoes when I know I got a size 9 foot. So what do I do now? With my critical thinking said, it's better I take off the shoes before I cause injury to my foot. But you looking at it and say, well, he's crazy, he's a madman. So you got to get your facts together. All right? Documentation, your progress notes, and in your care plans, because you're responsible for your care plans. So now, person getting hit. So let's look at a couple. One of the small ones would be what? Petechiae. Or what's petechiae?
Small red dots.
Are you sure?
Yep. I think so. Small red right?
Yeah, I completely agree with you.
Petechiae.
How do you spell
Small
that?
red.
Petechiae. Petechiae. It's a what?
Red spots bleeding under the skin.
Petechia is a red puncture lesion associated with capillary
Please look at the image.
breakage.
Look and see what it looks like.
Red spots.
Right. Cause.
Is it called?
What's the cause?
Trauma, a Lyme disease. certain
Line of bleed
medication.
from broken capillary blood
Bleeding is
vessels.
the skin.
Recent blood transfusion.
Sugar, medication, foliage, what else?
Blood transfusion,
Trauma. Trauma. You know, one of the things in pick-up floors when a person gets strangled, they look for these little spots in the eyes. It's indicative, this petechiae is indicative of a person being strangled or choked to death. All right, so that's petechiae. Look at it. So you can, when you see it again, you can say that's a petechiae. All right?
See it? See it here, see it here. It's a nice particular.
Now, the next one you're going to go to is purpurea. Purpurea.
Per
It already has
Pew.
pus and it's like kind of infected.
we
No.
Get up.
Purpurea. What's purpurea?
These colored spots on the skin that does not.
It's another purple spot in your skin, right?
Yeah, but
Petechiae is a
but
purple
don't
one.
blanch. This one don't blanch.
Look at it, please. See how much you look at the
They don't
purpurea,
blanch on a blind
different
person.
from, but not necessarily the petechiae blanch.
No.
So, look at purpurea. They both do the same thing.
how you spell purpurea?
Purpuric spots cause. That's where we're going to go to now.
Same thing.
It's the same thing.
Aging, trauma,
Mhm.
blood transfusion, certain medication.
And petechiae is different from purpurea.
Oh,
They will not give you purpurea and then call it petechiae. Look at the size.
Hemorrhage in the skin.
Look at the size. Look at the size. The petechiae versus a purpuric spot.
It looks similar.
How would you know the difference? Got the same thing.
All right.
Purpurea is a bruising. Bruise.
Is it non-blanching spot? Is one which does not disappear after greater.
What's the difference between purpurea and petechiae?
Purpurea are painful, non-blanching. The petechiae is non-blanching.
Red skin.
Guys, don't stick this non-blanching thing like that. Yes, we know it's non-blanching, but it's bleeding under the skin, so it's not going to blanch. Because when you use the word non-blanching, you should use it when you're using stage 1 to keep it also. You don't want it to mix itself up.
It says here that a petechia, they are smaller than 2 millimeters and are usually flat. And a purpurea, they are larger than 2 milliliters.
That's what I just told you guys, the size. Can I just tell you that? Take care of purpurea. That's the only difference. They're both the same bleeding, but one is smaller than the other one. That's all the difference is.
Just the size.
Just the size. The petechiae. When you see the small little dots, you know petechiae. See larger, purpurea. But now listen to this, please, because you could get a little mixed up now. Look for the word ecchymosis. Look for ecchymosis, please.
How you spell that?
Fading green, yellow, and brown with time.
ECH.
And of course, look for the causative factors. What caused it?
Blood outside the vessel. Blood outside the vessel secondary to bruising or trauma. Seeding, bleeding disorders.
It's a bruise.
That's the second time you use the word bruise. You know that, Mr. Kia?
Mm-hmm.
All right, be careful. Just
Okay.
understand when, how you're using it, all right?
Okay.
All right, so a lot of times we come across the ecchymatic areas, right? You hear that term a lot, ecchymatic areas or what have you. Be careful, because you're not sure if it's an ecchymatic area or not. So you're just going to use what? A discoloration. Reddish discoloration, blue-black discoloration. You don't make no diagnosis.
So when you say bruises, is it diagnosis?
So you,
I
When
got
you say
something.
bruises, if you, in case if you say it's a bruise, it's like a
no, I'm not talking about a bruise. I'm talking about, bruise is a common term. Ecchymosis is a medical term.
I
Right.
got something very
So
interesting.
be very careful when you're writing. Do not put down things that you're not sure of. Because like I say, it is a legal document. And nobody can tell you that you're wrong if you put the size, a reddish area of the skin, approximately, or blue-black discoloration of the skin, approximately. Nobody can give you anything wrong there. When the doctor now comes and say ecchymosis, then you take that,
Caused by bruising.
Yes,
right?
I think
You
this
go
is-
with what the doctor has down there, okay? He has made it, because you go write, patient has ecchymosis, and the doctor write, patient has purpuric spots. Now, what that says,
Can I share this?
two different things. Go
Can I
ahead.
share this? It says here that purpura are reddish purple, non-blanching skin discolorations, sized 0.3 centimeters to 1 centimeter, caused by bleeding under the skin. Then it says ecchymosis is a hematoma larger than 1 centimeter in size. Then it says petechia is a small hematoma less than 3 millimeters. Then it goes and says a bruise is bleeding under the skin caused by trauma.
All right. So throw bruise out. Throw bruise out. All of those can be caused by bruising effect. But like I was telling you guys, the size. Petechia is the smallest. Then you get a purpura. And then you get a ecchymosis. It's just a size. All is bleeding on the skin. That's why when you say non-blanchable, don't worry with the word non-blanchable.
It's small.
Because it's bleeding. It's not going to blanch. If you have blood on the skin, it's not going to blanch. What I want you to remember non-blanchable is when you're doing stage 1 decubitus ulcers. Because that's how you identify a stage 1 decubitus ulcer. A non-blanchable redness is a stage 1. If you do it and it blanch, it is not a stage 1. That's what I want you to remember with blanching. I don't want you to remember or try to memorize purpura and all these things with bleeding. Once you're bleeding under the skin,
That's it.
it ain't gonna blanch. The color is gonna always be that color. It's always gonna be red or brown or whatever color it is. It's always gonna be dark. Okay? But when you come now to do your decubitus ulcers, you gotta understand what's blanchable and not blanchable. How many times have you seen people, especially people who have lighter colored skin, who lie down on one side, and when they get up, the whole side of that face is what?
Red.
Red. And then what happens with the redness? It disappears.
goes away.
Goes away. So that's just a problem. That's just because of
Pressure.
person lying
Pressure.
pressure against that part of the body. All right. Now, the first part dealt with the first set of things we talked about things that's inside of there, a follicle or some possible cavity. The second set we talk about dealt with blood under the skin. However, whatever caused it, we talk about blood under the skin. You guys with me? All the second part there is blood under the skin. Then you have, and the word that was used just now was So what's a hematoma? But it's a blood, what? It's a little more than that. What's a hematoma? You're right, it's blood. Accumulation of blood under the skin. Look at it, please.
Outside of the blood vessel,
Usually hematomas are when that blood vessel bursts and bleeding, it accumulates. And when it accumulates, it's called a hematoma. Now that hematoma is what you guys would call a bump. Person got a bump in their forehead or on their knees or wherever they fall and hit and cause the blood vessel to become ruptured.
Okay.
outside of the blood vessel.
Okay? So now look at the bump, please, or a hematoma.
A hematoma is a local collection of clotted blood.
Say again?
I'm reading here. It says hematoma is a local collection of clotted blood.
Hematoma.
Yeah, I'm on. That's what you were
Outside of blood
Yeah,
vessel.
talk a little louder, okay? The wax in my ears is built up.
Blood collection that appears.
So if
as
you
a
talk
red-
that loud, I won't hear you. Lot of junk I got in my ears.
It says here,
I don't use Q-tips. You're not supposed to use Q-tips
you're
in
not
your ears.
supposed to.
You know, if you tell your patients to use Q-tips and something happened to them, you'll
Hematoma
have
is a
liable.
local
Not, the
blood
only thing you put in your
collection
ears
that
is your
appears as a
elbow.
Red
And your elbow can't go in your ears.
blue bruise. That's what it says here. And it gives us some more. I have two definitions here.
All right, so if a person have a hematoma, stay with me, guys. Let's move on. If a person has a hematoma, it's due to some kind of trauma, right?
Yes.
Because of rupture of that blood vessel. And when the person has a trauma and a rupture of blood vessel, what would be your nursing intervention? Person got a hematoma. Person just got punched or something.
Pain
Prevent
management.
for bleeding, trying to clot.
They're in pain.
Bleeding and try to clot it. Okay. Tell me more. What you're doing. That's good. Someone else?
They're in
Assess
pain.
it.
They may be in
Yeah,
pain.
you assessed it, yes, and you see, and then you're doing this in your head, right? So you see there's bleeding, person just get hit, you witness this person getting punched, or person just run instead of get punched in the
Put a
face.
cold compress.
Put the cold compress. And this is where you're talking about bleeding. So why do you put a cold compress?
To manually clot it.
How are you gonna, why do you mean you're gonna stop the bleeding? What's the rationale?
To slow down the blood flow to that area.
To alleviate pain.
To slow the blood flow to that area.
How are you gonna slow the blood flow to the
Because
area?
the code is it has the effects where it can constrict.
There you go. The word is constrict. So if you constrict something, if a vessel is this big and blood's running through it, and you put a cold, the vessel's going to be like this. Get small, so less blood will be going through. All right. So if less blood is going through now, it means that it gives the body an opportunity to form a clot to prevent bleeding from continuing. Right? Remember when we clear clotted factor? You have your thrombokines, which works on your what? Your prothrombin to form thrombin, which now works on your fibrinogen to produce fibrin, which is the final network that holds back those cells. The only thing that might come out is a little serum. But the whole thing is the coldness causes a constriction, which will help because something just keep bleeding like that. No clot is going to form. All right, and then you don't keep putting cold all the time. After a while, now you have to do what? Put heat. Because you now need to open up back, and now you need to get that dissolved for it to be taken away. All right, but the first thing you do is put something cold. Unlike what you'll hear a lot of older people say, boy, put something hot in there, you know. I'm serious. And they're doing counterproductive. They don't realize that it's later on. You put it there like, oh my God, you hit your head, you better put some hot water there. No, you don't want to put no hot water when the person hit their head. Right? You're just increasing the bleeding. All right. Now you're going to come across things such as also on the skin now. Let's move away somewhat from the traumatic situations. You can have situations whereby you get certain rashes like the eczema, right? And when you have these rashes that we talked about when we opened up, we said about rashes. Rashes in these things come under what is called dermatology. So anything pertaining to the skin, the root word is derm.
Derm.
So if you have derm is the root word, then an infection of the skin is known as dermatitis. But they put a T-I-S, right? So you have dermatitis. And then now, of course, having an infection of the skin or a problem with the skin, then you can have different types of dermatitis now. Contact dermatitis. So look up contact dermatitis.
Contact dermatitis.
Contact dermatitis is a red itchy rash caused by direct contact with a substance of an allergic reaction to it.
There you go. A direct contact. That's why I use the word direct. Something touch your body. Something touch your body. Think of things that touch you that will make you start itching and scratching, and then you got all these things come out in your body. That's contact dermatitis. Do not mix it up with wheals and hives and that sort of stuff. You guys with me?
Yep.
Now, see the type of derm, just look at allergic type of dermatitis.
You said allergic?
Yes.
No. It's too. Contact allergic which must have a syncytial exposure. Very exposure relation to the contact. Okay, it says here that contact allergic dermatitis must have a sensitizing exposure followed by a repeated exposure to the allergen to elicit the contact allergic reaction.
So what you guys just learned between the contact dermatitis and allergic dermatitis? Pretty much the same
Allergic
thing.
dermatitis is caused by a contact, direct contact with a substance.
It's allergic, it's a contact of an allergic reaction. It's just about the same thing you're talking about. If something gets onto you out there, the pollens can get you what? Allergy, but that allergy is not dermatitis, the allergy is what? URI, upper respiratory infections, right? It's a different type of thing. Talking about the skin. What happens to the skin when you're having an allergic reaction? Contact dermatitis. Now, just put on the, just go here now, stay with me guys, please. Go to list of skin allergies. List skin allergies. Uh-huh. Guys, on anything?
Then allergic skin reactions.
You guys can list
I
the
got-
allergies. You
I
guys
got-
find any list?
Yeah, contact dermatitis, hives, swelling. Can be caused by drugs, insects, food, pollen, latex, sunlight.
Anything that you know, people say that be careful you get stung by a bee. Not only can you get an allergic dermatitis, but you can get into what? Anaphylactic shock. So depending all upon the allergy that that person has. We all don't share the same type of allergy. I might be allergic to something and you're not allergic to it. I might be exposed and I will suffer, but you'll be walking around as if nothing is happening because nothing's happening to you. Right? So it depends. Depends upon the individual on what type. It's like right now we have the COVID-19 and we have people who are what? Infected but don't show no what? Symptoms of it. Why is it got people who have it and end up in the hospital and what? Respirators. So some of us, our system protects us better than others. That's what you need to understand. All right? And while we're there, just for your memory and that you know that persons who has a disease but don't suffer from it is considered to be
Asymptomatic. What? Asymptomatic? What?
person who have a disease and they don't suffer from it is
Carrier.
Asymptomatic.
carriers.
Okay.
Because they don't suffer from it, but they can carry it on to somebody else. They can transfer that disease to somebody else. All right?
Somebody else suffer from it.
Anyone who become exposed to them. All right, let's look at some other stuff that you can see around the body. Let's look at the head. Now, what about the hair?
Alopecia.
Your hair and your nails are appendages of your skin.
Right.
The hair and the nails are part of your skin. Okay, so it come under the same system. So what conditions have you done related to the hair?
Psoriasis.
Your haircut?
First thing, alopecia, right?
Which haircut you talked about?
Alopecia comes to mind.
I know which
Comes to
haircut
mind.
you talked about, but be careful.
Oh, God.
Okay.
Right here.
You have a dry hair?
Folliculitis.
There, what? Follicular.
Folliculitis.
No, right. I said the hair.
Oh.
So the hair, people can have the hair
Psoriasis.
being what? Lost. And when the hair is being lost, we put it under alopecia, right? And you have different types of alopecia, and most of the alopecias are related to
Traction.
use of chemicals. The women have used chemicals, the lies and what have you on their hair over the years.
That's all I don't like doing nothing with my hair. Just leave my
And
hair
end
alone.
up with
Yeah, take care of yourself.
getting, losing their hair. And then of
Cost
course,
of beauty.
people who have these tight cornrows and what have you, end up with traction alopecia,
Yeah, those come
right? The
from
traction damages the hair follicles, so the person will lose.
Wicked.
As you get older, you see back in the days, you see some young ladies with their hair all the way down to their feet, and then in their latter years, they ain't got nothing for their head. They gotta wear wigs. Why? Because of use of their whatever to be in style at the time.
Systemic disease and can have
And that's, so the hair comes up from your hair follicle. And the hair follicles are your scalp. So the condition the scalp is known as, what conditions you have with the scalp? You have folliculitis, of course. Dandruff. That's the only thing you got to the scalp and the hair?
Cradle cap?
Cradle cap.
Headlights?
There you go. And then there for headlights is pediculosis capitis. And when they get into the head there, the pediculosis capitis, you know it's contagious. And you need to have the kids especially not go to school and what have you, because it can move on to someone else. Pediculosis capitis, and then you can have
Ringworm.
tinea capitis.
Folliculitis.
Tinea capitis is your what? What's tinea capitis, guys?
Ringworm.
Fungal infection of the scalp.
Fungal infection.
And of course, with all of these things, antifungal medications and creams, topical treatments for the head lice, or just cut all the hair off the head. All right? But okay. Now you go to the face. What else can you see in the face? What conditions you think we can see in the face? Hmm? Well, sometimes you look at somebody's face, you say, oh my God, you might have a problem. The ugly? I thought somebody said ugly. Perhaps some people are ugly, but we don't want to tell them that they're ugly.
Greasy face.
A what?
Greasy. Too
Oil.
greasy. Oil.
Oily face? Okay.
When we talk about
Acne.
You guys remember that butterfly rash? Right. Come with age. Wrinkles with age, right? But
Hyperpigmentation.
because we're using certain words, the students, we said like alopecia just sounds lost. So let's go with hirsute, which is a lot of hair, and especially women, hirsutism in women. And I think I've given you guys the wolf boys. You look at the image of the wolf boys, and you'll see what hirsutism is. Hirsutis. Hirsutism. HRSU.
Hirsutis is the male pattern of hair growth
And if
in
you look at a
women.
picture of person who
It
suffer
may
from
be normal
hirsutism,
or
you're gonna see that the,
result
especially
in
the
excessive
females,
secretion
the
of
females have a lot of hair on their faces.
androgenic.
And when they have a lot of hair on their faces, of course people look at the body image. Because women is not supposed to have hair in their face. Right? And years ago, and even now, the women who have those hair, some of them have beards, they put them with those sideshows, those carnivals. So people can go and see a woman with a big beard, because that's unusual. People pay money to see that. That is
Excessive
called hirsutism.
secretion of cortisol.
Okay, and now let's move to another one. HIR, hirsutism. Hirsutism.
Unexpected areas.
Now, on the face, you can also have rosacea. Look up rosacea.
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 RSACEA. It's a long-term skin condition that typically affects the face.
And guys, please look at an image. Don't just look up the word.
Rosacea.
See what rosacea is about. Rosacea.
Chronic skin disease of the middle-aged and older persons.
Rosacea. I don't know how to spell it.
ROSACEA. Chronic disease, contract.
Am I pronunciation that bad?
No, your hand in your mouth and you have.
My hand in my mouth.
And you have the mask on.
And the mask on, I got a hand in my mouth. So I put my hands under my mask. You're seeing a lot.
It's like a swelling red bump. That's even better than the hair.
It is easily confused with the acne.
Oh, that might be that growing under, right? Like you talk about earlier, for women. No, this one, that goes on.
Years of
This is
age.
swelling red bump. I know swelling red like an infection, like, a piece of hair that's growing,
From work, too?
that's going under the skin. Like we talked about that earlier, but for kind of men, but this is a same thing for women. The hair didn't come, the hair did not come out.
The hair did not come out. You talk about the razor bumps. When you have your hair turned back in, that's what you're talking about?
It's not.
Which one are you
Going
talking about?
inside instead of coming out, like the first word you said.
Okay. Usually have, in those guys, it's called ingrown hair. All right, so the rosacea, and let's continue. You can have a cyst in the face, right? A cyst in the eyelids.
Okay. Rosacea.
Cyst, eyelid.
Cyst eyelids.
CYST. No, this is called cat bite. Somebody give you something and then you take it back, you get it under the eye. But this is not really so. Alright, so you have a cyst in the eyelid. And one thing you know with cysts, it's benign and not malignant, right? And usually you have to have it removed. Are we guys good there with the eyelids and the cyst?
Yes.
Okay, so let's move to the next.
Ovarian cysts. I have some other cysts. But I'll find out.
The next you're gonna move to is herpes simplex.
Herpes simplex.
Herpes simplex.
So it's, I'm sorry, going back to the cyst on the sty is
Sty is
different,
different.
or is it the same thing?
Pretty much the same thing.
Because the
Probably.
sty leaves on its own, but a cyst,
You gotta do
you have to do a
removal.
removal.
Right. So let's go to herpes. Herpes simplex. Right. Herpes simplex. Type.
I even
All right.
still want to talk to you.
Per piece.
So PES. What's in the herpes? It may not be exactly the part that, Yes. All right, Stan, we want to talk to you guys, so just listen up.
Hey guys, I think the class is over at 9 tonight. Well, good afternoon, first of all. I think the class is over at 9. It's been a while since I've seen you guys. If you do, or if you want to have like a quick meeting with me, as far as, some who have received phone calls or haven't regarding your processing status, if you hang around till 8:45, I'll be there probably like 8:30 and wait till class is done, but don't leave. I'll come and speak to you guys downstairs. If anybody wants to see me, let me know now. I can be there for 8:45. If not, then I won't come.
Any of you guys want to be here to see Sandy? Do you have any questions for Sandy? You have? Okay, a couple of the students said they want to speak to you, Sandy.
Okay, so that's fine. That's fine. So, all right. So perfect. So whoever wants to speak to me, I'll see you guys at 8:45. All right.
Down
Okay.
here.
All right. Thank you,
All
Mr.
right.
West.
No problem. All right.
What was that eyelid spot?
Islands of Langerhorn.
If you want to speak,
I don't understand what you
because I
said.
don't know,
Eyelid
it's
cyst.
something with the
Eyelid
process
cyst.
that you guys who have already
eyelid
come,
cyst.
you guys already
Let me
did
see.
your paperwork.
Cis
So I guess it's
eyelid. Cis eyelid. CYST. And then eyelid. The eye.
I said, no, we better come and talk to class, because since we do this stuff, we do
I think you guys need to talk to him a piece. Because I've been hearing a lot of different stuff and I don't want to,
He
I
need to
don't know.
clarify it, he need to
Right.
clarify it, that's all.
So whether you come there and you guys can talk to him as a group. Like I told persons last night, that I have no idea about anything. I'm just clueless. So anything you want to know, all I do is teach.
That's what he put in your head.
Put in my head? Nobody put none in my head, trust me. Not his head.
That's what he told you.
Very independent person, extremely independent. All right. So the last thing I asked you guys to look at was Herpes simplex type 1.
One?
That's type 1. Herpes.
Herpes?
Herpes.
Oh, herpes, yeah.
Herpes.
Oh,
we're looking for
It sounded like,
herpes.
I think of herpes, I know it was herpes.
Can I read?
Herpes simplex type 1. Let's go, please.
Can I read? Herpes simplex is a common skin infection. There are two types of causative virus, which are identified by viral typing. In general, herpes simplex type 1 occurs on the skin of the lips,
All right,
mouth,
so stop.
gums,
That's
or
where
tongue.
All right, so this is one we want to talk about. It's viral, right? It
Yes.
occurs on your
Lips,
So if it's
mouth,
viral,
or
what it means to you?
can spread.
contagious.
Is it
Can spread.
contagious?
Yeah, if it's viral.
Viral, it can contaminate others with it.
So how is it spread?
Kissing,
Contact.
contact. Yes.
Contact?
Contact.
Contact spread, like kissing. That's why you don't go around kissing babies or whatever. And a lot of people call these fever sores. Ain't no damn fever sores. fever boil or fever sore or all them bases, you got herpes. And the thing is, a lot of people have got it. And it's not this person's fault. Because they know that it's something that can be related to herpes simplex type 2, which is genital herpes. People have a tendency of just saying that, hey, you put your mouth where it's not supposed to go. But it's not necessarily so. A person could have kissed somebody and don't realize that that person have herpes simplex type 1, and they get it on their mouth. And when they get it, so you gotta be careful if you see somebody, and that's how you're gonna teach, by the way, not you. When you're teaching, you're gonna teach that if you see a person has little boils on the lips, you do not engage in kissing that person.
Even if it's.
If you have your child, don't let us, people like to kiss babies. Don't let them kiss the baby. 2, it may not be boils, it may be now dry. And when it's dry, that's the worst stage. That's when it's really contagious, when the boils pop. That's when it's really not contagious. Now, when you see that little mark on top of the side of the lip, don't kiss it. Don't care who it is. It could be your other half. And I'm serious.
I have a question.
Because if it's the other half, it's your husband or your wife, and they have it there, maybe they might got it just from kissing somebody sometime way back, when they were a child or something. Somebody come and kiss them on their lip, and they have it. A lot of people have it, and they did not do anything that's wrong. And that's the whole thing you got to try to get across to people. Herpes simplex type 1 of the lips don't mean that you did something wrong. But you have a virus in your lip that you can pass on to other people. Now, herpes simplex type 2, that's a different story.
It occurs in the
That usually occurs down in the
genital area.
Usually when you have it. And the same thing for the lips. If you see the boils down there, and that's why I always tell a person, before you have sex with anybody, and especially the first time you're having sex with them, ensure the lights is on, and look at it. No, that's not funny, it's serious.
Can it be on the top?
Look at it.
Even the man.
Inside of the
Look,
mouth?
and keep the light on bright. And then the person said, why you have the light on? Say, I just admire you, and I love to see you. But you're really what you want to do, you want to look and ensure that there's no boils. And not only the boils you're looking for, you're looking to see if there are any dry spots. If you have some dry spots in it, that's when it's really, really contagious. All right? Yes, ma'am.
Yes, so can it go in remission and you don't know and kiss the person?
A lot of people who have herpes, it's for life.
Yeah, but then if it's not showing, because I know an individual, I saw it
You don't have a
once.
problem.
Huh?
The problem is when it's up.
Oh, but if
When
it's
it's
not
flaring
up.
up, when it's flaring up, yeah.
A lot of people, maybe right in this room, we have people who have herpes,
Oh, okay.
right? Right in this room. I'm not
Somebody
kidding
can
you.
have herpes and you don't know they never had no breakup or anything. How would you know if
You're not gonna know the person
So
that
that's
comes
not
not showing up
infectious.
with no signs and symptoms of it. Usually persons who have, and if you look it up there, guys, and you're gonna read, is that when persons are under emotional stress, that's the time when it usually presents itself. When you're under emotional problems, your immune system goes down. And when your immune system goes down, these viruses, right, it's just like the immune system with the COVID-19. If your immune system is down, the COVID-19 is gonna mess you up. This is a virus too, the same thing. It's like you have the flu. Some people get the flu and in a day they're all right. Some others get the flu and the whole week they're coughing and carrying on. It depends upon how good is your immune system. Okay? What you want to know though is underlying cause. Herpes simplex type 1, a lot of Americans, like 80% of Americans got it. herpes simplex type 2, genital herpes, you gotta teach people to look. And
It's more commonly in male.
who said so?
Oh.
It can be. It depends upon where you live in. United States or somewhere else. It depends. If you live in a Muslim country, it ain't gonna be more common in the male
Got a question.
because you have many wives or something like that. Yeah.
How do we differentiate between herpes zoster and herpes simplex?
Herpes zoster shingles. And it's dependent upon where in the body it is. Herpes simplex type 1 is on the lips. Herpes simplex type 2 is on genital area. Shingles or herpes zoster is on the body and is only on one side of the body. Why? Because it follows the line of the nerves. And the nerves don't cross the body. So you normally will see herpes zoster or shingles only on one side of the body. And that's how the doctors will do their diagnosis of those type of things.
Thank you.
All right? And but also you gotta know that these things are contagious viruses. And shingles and these things can cross over the placental barrier. And if you want to teach people that if a woman is pregnant, she should not take care of a patient who have herpes zoster because it can pass on and can pass on to the baby and cause problem.
So Mr. West, with the elderly patient, right? When they have all those warts on their body, because somebody told me this patient has herpes. That's why she have all the wart breakouts, Mr.
Warts is something that, and we're not talking about skin tags. People have skin tags, which is just growths to come out. Well, warts are contagious. And if that's why, say when you're having sex with anybody, look at the genital area. If you see a wart, you gotta be careful. Because once you have body touching body, you will get the wart. And you'll get genital warts. Just look it up, please. Genital warts. Look it up.
You're talking about before the contact. If I'm just looking at it like touching, I'm not in it.
Let's see what genital warts are. And then look at images.
Genital warts are one of the most common types of sexually transmitted infections. Nearly all sexual active people will become infected at least one type of the human papillomavirus.
The warts can disappear and they can come up back. And when they disappear, not fully. But some people can have the warts so bad that if you look at some of the penile warts or you just look at images. Just look at penile and vaginal warts.
This also says here that genital warts are caused by the HPV.
Same thing that caused you to get cancer of the cervix. Virus, guys.
And
Herpes.
genital herpes, I said, is caused by HSV.
Herpes. HSV. All right, so now we move from where you had things or like balls in the skin that got it purulent stuff. Then we move to trauma, blood bleeding. Now you're talking about things like losing of the hair, and you're looking at how persons can get basic little things. And for this part where we're talking about now, a lot is based on
I think so.
you doing patient teaching or patient education. right? Because a lot of people seem to think that when the warts are there, or they see the warts, it means nothing. For you, when you see the warts there, and not like, you may see some warts that, or you look up there, you see a whole lot of cluster of stuff, and you could know right away something is wrong. But some people may just have one or two, and the mere fact that you have sexual contact, you'll get it. You know, 2 ways about it. You will get
I
it.
can't even identify that.
And there's, no,
I can't identify that
it's
image.
gonna stay with you for the rest of your life. You're gonna have warts coming and going or whatever it is, it's gonna stay with you the rest of your life.
make you sick or anything?
Not really, it's just gonna make you feel uncomfortable thinking about it, that you have that down there, and especially if you're not married or something like that.
Does it itch?
I don't know, man, what itch?
Ask me, do you want that
Mr.
warm itches?
The herpes simplex type 2 will itch a lot. And that's why I see a lot of times people will be like, they'll scratch here, but it's not here they really want to scratch. They want to scratch far enough, because you got a lot of people around, you can't scratch where you want to scratch, so you're gonna be like, and then they're gonna be like, I gotta go and pee. But you don't really want to go and pee because you want to go and what? Scratch.
I gotta-
It should come back and
I have a question for you.
It is intense itching. That's the word they use. Intense itching is
Itching.
herpes simplex. With the warts, it's a different thing. Warts, you're looking at the situation where you have a lot of stuff coming out there, and you know, especially in this day and age where women talk about what's happening with the Brazilian what? Wax, bikini wax, and because they want it to look good. And then all of a sudden you're seeing what? Bumps and things all over the place. It ain't gonna look good. You can't wear that, what's it that? The tongues, you can't wear the tongues, you can't wear certain things because you're gonna look like a case. All right, so you have those viruses. So we talk about the lips and the genital, we talk about the herpes zoster, which is shingles. Those are all viral situations. Then we talk about the fungal situations, which will be like your what? We talk about tinea, capitis.
Capitis,
Then you have tinea
pedis.
pedis, right? Then you have tinea corporis, meaning that you have the fungal infection about the body. And then you want to look also at, we talk about head lice, which is tinea capitis. Then you can have the one in the genital area is called tinea pubis. So look it up, tinea pubis, and look at the difference between tinea capitis and tinea pubis.
Tinea pubis. Ringworm.
And what's your tinea pubis? Look for pediculosis pubis. Pediculosis pubis. Pediculosis pubis. That's a tinea.
Mm-hmm.
Yeah. And then pediculosis pubis. Pediculosis, pubis. Pediculosis pubis.
Pediculosis, I spell pediculo,
CU, not QU.
C-U-L-A-R-I-S.
Pediculosis pubis. You should see a nice little
Want me to
You
read?
guys it?
Want me to read on that?
All right, read and then guys look for the image.
Okay.
Crab loaves, that's what it's doing. It's crab loaves.
Pediculosis pubis is a common disease brought about through contact with a member of the lice family. It is particularly noted for living on pubic hair, but can extend to hair on other parts of the body.
How do you get it?
It's often called crabs.
Right.
Somebody have it?
Through sexual activity with someone already infected, or by contact with infested clothing or linen.
So, normally, a person who has pediculosis pubis can say they didn't sleep with somebody, but they're having these lice in the pubic area. But it can be that they like to sleep naked. And when they went to a hotel, it might have been on their sheets. And then once it's on the sheets, you're gonna get it. So it doesn't necessarily have to be due to sexual intercourse. It could be due to dirty linen, or you're wearing somebody else's underwear. Do people wear somebody else's underwear?
All the time.
Like me?
I said all the time.
Don't you wear your husband's underwear? Of course, if you come here, you put down your husband's underwear sometimes. No, you can take it off, you just put it down to go to the bathroom or something. All right, with the capitis and the pubis and all these things and the worms and the crabs and all the stuff, remember this is mostly for education and for you to teach people so that they will not get it. You know, so you know what to do, so you won't get it. But if you're happily married and or with somebody and you're monogamous, then you're gonna get it. But if you're not monogamous and you're still out there, then possibility that you will get it. Right. Or you go to a hotel, and you go to one of those cheap hotels who don't clean the sheets properly, you will get it.
Okay. Thank you.
No hotels, some they got go away to the islands or somewhere for, just get to, what?
You gotta sue the motel, make money. You sue them. If you go to the motel,
Yeah, motel and motel.
I know.
it's the same thing.
Fast track that they don't
It's not the
have
same.
time to wash. So you go to a hotel, you use a 5-star.
What's the difference between motel and hotel?
Motel is cheap.
Motel?
Fast track.
Okay, so motel is affordable.
The fast
Yeah,
track.
yeah, there you go.
It's a drive-through.
You can just walk in, no security guard, nothing.
Oh, okay. Motel
So
is
if
better.
you're driving going down to Florida, and you have to stop, and you have motels all along the way, are you trying to say those that motels are bad?
Yeah.
I thought they were, because most of the time you see motels. When you're driving going down, you have motels all along the way that you can stop at.
Sorry, I'm not stopping.
That's a five-star motel.
In my car. I'm stopping, I'm sorry. I don't want to.
That's a 5-star motel.
I don't know, I know I went to Florida a couple of times and I stopped at the motels, and
How was it?
that's no problem.
You don't bring your own shower, your own sheets.
Bring my own what?
Bring your own sheet.
No, you should drive it.
Why?
You get a quick shower.
Why would I bring my own towel and all my sheets if I'm going somewhere that they're supplying you?
Just in case.
Towels, ew.
Well, if you don't use it, God bless you, I use it. And why I use
You
it?
have to spray.
I spray nothing, I use it. And I still have not any day. Thank God. the soap is be inside of a packet. If they have the soap open, then I know the soap is not right. Two, the water that you get in America is hot water and regular water.
She said check the expiration date.
Hold on, babe, the soap. Stop it, nice lady. This thing here, you use soap. Anyway, that's a personal thing. You think for your own protection, right? That's you. But me, I ain't buying no personal nothing. I'm just gonna go to the hotel and.
Don't come back with anything.
I do a lot of hotels in my life, plenty of hotels, plenty hotels, enough hotels, more hotels than you
You
can count.
just cover and
If a person cover what?
just cover it and plunge down there.
Exactly. What's wrong with that?
You just said you might get, crab legs.
But he's been good so far.
I haven't got anything.
It has no symptoms. You might have it, you don't know.
Hey, I haven't got anything. Right? I know what it is.
Doesn't eat or nothing.
What's that? No. You don't get the virus like that. What you get like that is a pediculosis, the lice. Not talking about a viral thing. And it's only if you take that sheet and forget bacteria, it's a dirty sheet, and you put it inside of you, then you get transferred contact. Then you have a problem. But you put it not inside of you. So, guys, there's something called staphylococcus. And the staphylococcus is on your body all the time.
Yeah.
And the moment you have a break in your skin, the staphylococcus go in, and that's what's caused problems. So you always got around you. Even the stuff that you carry with you have microorganisms on it. You could just take it out to the wash and what have you, you're carrying microorganisms. All right? Just so you know that. Okay. Now, when you look at the skin, you can see different things, right? You see here, you see the pigmentation we talked about, the one just now with the dark coloring to protect yourselves. But then you can have an unusual blanching of the skin. Like what happened to, let's say, Michael Jackson. So let's look up for the word like vitiligo or vitiligo.
Vitiligo. VI.
Vitiligo is a sudden appearance of white patches on the skin.
Just please look at the image of what the vitiligo is all about. Mom, you gotta tell me.
No, it's just.
You expect me to get my walk over there, get from my seat to walk over there? You think I'm such a young person that could just jump up and down?
Showing you the picture.
Well, how am I gonna see?
That's a
Oh,
supermodel.
you can see it?
She got it in her face, by her mouth?
She has a whole body.
Vitiligo. All right, cause of vitiligo, guys. Come on, let's go. It's hypopigmentation. We know this. The melanin is not there, right? Right. So cause. That's what we're looking at right now. Cause.
History, hereditary, disorder of the immune system,
Passes through the family.
trigger events that stress, severe sunburn.
You ever see people with sunburns? You ever see when a woman go on the beach and come back? All the other parts are dark except certain part where the brow was or where the panties are at. I don't know why the women don't just go naked. I'm serious. Go to if you go down to the
Jamaica.
what? They know what they know dignity. They know to hide. You go to,
Hedonism.
the nude beach, and you go there and you just be yourself. True.
You visit.
Huh? Because they have the private beaches, and the private beaches, but there's not everybody can go in there. First thing, it's more expensive than the other regular
No clothes beyond this point.
hotels.
No, for real.
You
No
go.
clothes beyond this point.
I mean, sometimes I've been to a few where then when you look,
Did you go naked?
no, I didn't go there. I sit in the balcony.
They give you stuff to put on though.
But the thing about it is that when you look, is that some of the bodies you really don't want to look at it. And that's the only thing. But people go for their own reasons and they wear it naked. And my concern is that the people who go out onto these beaches is that they should use adequate sun protection. Because a lot of them are from Europe and what have you, and puts them at high risk for skin cancer. And they're like, oh my God, oh Lord have mercy.
So it can be autoimmune.
That's your body kicking up against you. Heredity or your body kicking up against you. Wherever it is, it's not something that's you want to have. Right?
It's alright. You can have melatonin, right? I mean, it's spread all over your body. Like skin cancer.
You mean the vitiligo?
Yeah.
Which one? You can get it all over. Do not mix up the vitiligo with
It's illegal.
persons
It's a
who
condition
have,
in which the skin loses its
you know,
pigment
yellow man from Jamaica.
cells. That is
What yellow
mulatto.
man had?
Melanin.
Look at the albinos.
Oh, done and done this.
Look at the albino.
And
Albinism.
I think like two really bad, couples that.
You guys find person using albino?
Uh-huh.
Male and female albinos.
Uh-huh.
This is now, we're not talking about vitiligo now. We talk about a person who was just straight up albino.
absence of pigment.
Absence of the pigmentation, right?
Mhm.
Pigments. So if a person, on this critical thinking now, listen to me please, if the person is an albino, what would be your concern?
Skin cancer.
Cancer of
There
the
you go.
skin.
Skin cancer. If you guys see Yellow Man now,
Yeah, ugly.
you'll not believe how this man looks horrible.
Horrible.
Why? Because he has a whole set of these same skin cancer things. They have to do surgeries and surgeries and surgeries. And the poor man don't look like a man anymore. But he's still singing. But if you look at his face, he looks really, really messed up.
Which guy? Who?
Yellow man. He's a DJ
You
from
guys can look it up.
Philippines.
Yellow Man,
Mm.
Jamaican singer, Yellow Man. Look at an image of him before and after. When he was just Yellow Man. And then look at him today. And look at the difference. Then and now. And I really, really love Yellow Man. Love my love upon the King's Highway, the Queen's Highway. That was one of his songs, stuff songs.
So what happened to his face?
Ripped it
Oh,
up.
no.
That is all I
That's
can
because he
say.
was albino? Now, but people who have albino, their face starts to.
No, 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 no. Because of the skin adjustment, you just said it.
Because of the.
So why is mouth look like that?
But
Because
the
he had
surgery-
all kinds
Cancer.
of surgeries, too much surgeries. And he live in where? Jamaica. And when he going out to do what? To sing.
Concert.
Concert is, all them concert is open air concert. And he's gonna be in what? Exposed to the sun. asthma, love up on the king side or the queen side.
I love that song.
I love that song.
Okay.
I
So
love
you drink
that.
the true every day?
Yeah, he died already. Oh my God.
You drink the true every day?
Well, when he died?
When did he
Maybe
die?
another Winston Foster.
He died?
I don't know. I never heard of
Till
it.
one.
I don't think he
No, I think
How come you would have hear it, right? If he died.
No, he
He
said
died?
it's still living in
There's another person.
Maybe someone else. I grew up listening to Yellow Man when I was in the military. Yellow Man was who I used to listen to all the
Yeah,
time,
I'm watching.
especially when we out on location. I just got a little, back in them days, of transistor radio. Lord have
I play
mercy.
sometimes. Not them. Those are like
You can't
those are the kings. Yeah.
You can't go to
No, no, no. It's like one of the top 2 in the whole world. No, one of the top 10. Yeah.
All right,
Everything he does
you
is
guys
made.
have seen the different skin conditions. You see what can happen. Now let's move to another part. The skin can be damaged if there's too much of pressure put on the skin. And when we talk about pressure being placed on the skin, we have a tendency to talk about decubitous ulcers. And when you talk about decubitous ulcers, you gotta start talking about the stages. Stage 1, 2, 3, and 4. And based on those stages, you have to have an idea about the skin layers, because stages are based on the layers of skin. So
That's what he does.
basically
He makes money.
decubitus, and the word is decubitus and not decubiti. Decubitus ulcers or decubitus ulcer. Some people put decubiti to make it poor. There's not such a word as decubiti. Persons who suffer from decubitus ulcers usually have it occurring wherever the skin is close to a bony prominence. And the bony prominences, as you know it, will be located in the back of the head, your shoulder blades, the lower spine, which is usually your sacral, coccygeal areas, your hip bones, the back of your heels, your elbows. But not just because it's close to what we call the bony surfaces that we have the problem. You have to take into consideration that what are the factors that cause or put a person at high risk for decubitous ulcers. So what are the factors? So based on your knowledge, what are the factors that puts a person at risk for developing decubitous ulcers? All right. Decreased mobility. Okay. Well, that's a decubitous fluid circulation. What else?
Pressure to one area.
Yeah, what are some factors that put a person at risk?
nutrition. I was thinking.
Poor nutrition? Okay. But if you're going to tell me poor nutrition, what do you mean by poor nutrition?
Inadequate calories intake.
What do you mean by inadequate calorie intake?
They're not taking enough calories.
Like protein.
They're not
Eating right,
eating
they're
the
not
way
eating
they're
right.
supposed to.
Incontinence.
If you're talking about nutrition, you wouldn't talk about calories and caloric intake. When we talk about caloric intake, we talk about what are the energy requirements of a person. You have different type of foods. You have your macronutrition, it's going to put you to your carbohydrates, your proteins, your fats, basically dairy products. And then you have a protective food, which would be your micronutrition, which would be like your vitamins, both your water soluble and your fat soluble vitamins, and the trace minerals. So if you're going to be telling me it's based on nutrition, what do you mean?
They can't, yeah.
So the person
And
has
then your
poor
problem.
oral intake.
Cancer.
They have problems with their teeth, such as
Missing tooth, aren't you?
Missing tooth.
Liquid stuff.
what do we call when a person don't have teeth?
Huh?
What's the third word when we call a person who don't have teeth? No teeth. You're absolutely right, no teeth, but what's the
Stomatitis.
medical norm for no teeth?
I think it's stomatitis, I'm not sure.
It's edentulous.
Inflammation of the face,
Edentulous.
stomatitis, edentulous, okay.
Patient is edentulous.
What was the word? Dangerous.
Edentulous.
Edentulous. That's the medical term. They ask you to tell me no toothless or no teeth. Edentulous. All right, so the patient is edentulous is one. What else?
Cancer. In the mouth.
Difficulty of swallowing.
We
Aphasia.
went through a lot of this when we did that thing in the back there. The GI feeds, remember? Why you have to get GI feeds?
Yeah.
The reason why you gotta get GI feed. All right, so that's nutrition. What else?
Aphasia. No, dysphagia.
Dysphagia, I think.
Dysphagia. Difficulty of
I think it's dysphagia.
Incontinence.
All right, we said that when we talked about the GT tube feedings, we talked about that, right? What caused you to have GT tube feedings? Because you have all of
cancer,
these different things, and what can affect your nutrition? So all right, let's forget about nutrition. What else can put you at high risk? We had decreased mobility, we had nutrition, what else?
Incontinence.
condition in your throat.
Incontinence.
Cancer.
I don't want to hear cancer anymore. No cancer. You have three things here. You have decreased mobility, you have nutrition, and you have incontinence. What else?
Diabetes.
What are the risk factors? We could put diseases. Didn't want to say diabetes. But then I would ask you why you say diabetes. What would
Because-
be the risk factors? For
Increase the risk of tissue damage.
what risk factors is what are related to a person or can cause a person to get decubus ulcers. What can cause decubus ulcers then? All right, what causes decubus ulcers? Let me put it that way. What causes decubus ulcers?
Breakdown in the skin.
We already nutritional, but not nutrition. We already did mobility.
Gingivitis, like you have infection in your gums. They have to move
You're not losing me. You lost me. No, we talk about the skin, we talk about decubus ulcers. What can cause decubus ulcers?
Being in bed too much.
Decreased bed mobility. That's a different type of ulcer. We talking just specifically Boston?
Pain in the mouth.
Dryness.
Skin conditions. All right, let's get started because we're gonna be on this too long now. The thing is, you can look at one. The patient has decreased mobility, especially decreased bed mobility, meaning they can't move on their own. Two, the patient more than likely can be incontinent. And when that person is incontinent, especially if they're incontinent of feces, it will cause damage to the skin. 3, when you sit in a chair and you feel uncomfortable, you move unconsciously. You shift your weight so that the weight is not, because that's what causes pressure, right? But when you have a person who have cognitive problems, that is, in a coma, they can't move, right? The person has severe dementia. They don't react to the pain and the normal things that you do to alleviate or relieve that pressure. Those are the main areas. You know, when you start to go off into the other areas now, like dryness of the skin and that sort, that is over a period of time. And that has to be related to one of those that we just talked about. Dryness of skin don't cause a person to break down. Dryness of skin is not going to cause pressure ulcers.
Friction.
It is not going to cause pressure ulcers. Pressure ulcers when a person is staying in one place, they're not moving, and the skin is breaking down due to poor circulation. And the skin itself, not just a poor circulation, the bed is wet, moisture start to break the skin down. That is why you have to turn and position the patient to increase what? Circulation. So when you're talking about all these other
4
things,
nights.
those other things that you're talking about must be associated with one of these. Why is the person not moving? You ask the question, why is it the person is not moving? Don't just say the person not moving. Why the person not moving? Person had a coma, is in a coma. Person had a stroke. Person had an accident and have TBI. Person had a fracture, hip fracture, so they can't turn. Somebody got to do it for them, right? Or is they going to get the problem? Understand the concept. Decreased mobility. What will cause a decreased mobility? And what you as registered nurses need to do. That's why they focus on turning position every 2 hours or PRN. And if you can't turn, you're going to have what? Small body shifts. So to relieve the pressure. Because if you sit right now, right where you are, for the next 50 minutes without moving, your butt is going to hurt you. If you sit down there without even shifting a little, your butt will hurt you. Have you ever gone on the floor to do something and you kneel down? And then next thing you're oh my God. Let's see like guys that would be.
Second.
Stage 1, unblanchable redness.
Unblanchable redness.
Looking at the first layer, right? That's the epidermis. So if a person having redness, what will you do for this patient to prevent this person from getting this decubitus worse? That's stage 1 of the decubitus. So what do you do?
Turning schedule.
Turning schedule, what else?
Barrier. You put a barrier.
Barrier cream. That's what you're saying.
What else?
Can you massage it?
Can you massage it?
That's where it comes. You do not put on, why would you want to put on barrier cream? So right now you put barrier cream? If you rub or massage a reddened area, that is a stage 1, it will get worse. You do not massage.
Okay.
And you're going to see everywhere do not massage stage 1.
But you
Don't go
can't.
rubbing stage 1.
But you can't put a barrier
You
cream.
put like cushions, pillows.
What you do is alleviate pressure.
Pressure.
That's all you got to do. Alleviate the pressure. Get the pressure off the area and it will heal. That's all. Alleviate the pressure. However you're going to relieve it. Use those elevated, elevated footrest, elevated this, elevated, everything that's elevated, take them off the bed. Now you go to stage 2. And when you go to stage 2,
Skin is broken.
you go to now the next layer, which is the dermis. Now you get your dermis involved. And the skin may not be broken. You may have a blister. But what will happen to the blister? It will pop. So therefore blister is known also as a stage 2. Why are you shaking like? Nervous? Focus, please. Focus on what you're doing. Stage 2 can be a blister. And when that blister breaks, it is still a stage 2. Are you guys with me? So if a person has stage 2, now you got to start to do treatments. And you have different type of treatments that can be utilized. Some may just put upside over it, protect him. But the same thing like the first term also, you want to relieve pressure on the area. Now you could get a stage 2 or breakdown happening in some areas that you don't expect it to happen. A stage 2 could happen under your breast, where you're using breast areas with bones or whatever you call it, or whatever, mesh or whatever they have in it. That will cause a stage 2. Having a nasal cannula where the tubing is around the ears will cause stage 2 behind the ears. Okay? So it is not just the elbows and butts and all these areas. It can very much be behind your ears, under your breast. So you gotta tell the person what is the right brassiere to wear. And persons must keep checking to ensure that behind the ears of a person who has a nasal cannula that there's no pressure there to cause damage. Because if you put your hands behind your ears here and press, don't feel you pressing directly onto what? A bone. So skin and bone, that's all there. Now stage 3 is that we go down to the next layer. 1, 2, and 3 is that we go into the subcutaneous tissue. Now we're talking about depth. So when you are measuring, you're measuring depth. It's not just the circumference, length and width. You're going down because now you're going through into the subcutaneous tissue. Now when you go to subcutaneous tissue stage 3, based on the situation, that can be considered reportable to the Department of Health.
Extensive tissue
No
damage.
person is supposed to go to stage 3. Stage 3 can be indicative, even stage 1 and 2 can be indicative of
Poor management.
nursing care. So, very important that whoever checks your ulcers When a patient comes back, like if you work in a nursing home, patient comes back from the hospital, you have to ensure that whoever does the assessment, which is a registered nurse, must document every little, anything in the body. If you see a little redness, they document it. Because that redness can become stage 2. Now when you come to redness to become stage 2 in the hospital, in the facility, it is now nosocomial, meaning it happened in the facility. But it didn't really happen in the facility, it started somewhere else. And because the nurse did not document, the facility has to own it. And if the facility now identifies the patient has a stage 2, they do the investigations. And then if it gets worse to stage 3, that's a problem. It means that whatever you're doing is not working. Because decubitus ulcers are avoidable. When they become non-avoidable, it means the doctor has to write and document that due to the comorbidities that this patient has, it is a risk of this patient developing a stage 3 ulcer. Now, the ulcer depth may now increase. Remember, we talk about depth now, right? So 2, we talk about circumference. 3, we start talking with circumference and depth, right? 4, we start going deeper, more depth. And this is when now it's gone into the muscles. It's gone deeper. It's passed through now the subcutaneous tissue into the muscles. And what you think the patient will be at high risk for? Infection. You're absolutely right.
I think the patient been in high risk for infection.
Once it starts to go deeper, it's
High
invasive
risk.
now, right?
Yeah, high risk.
It will develop infections. And with infections, you're going to have damage of tissue. The damaged tissue is known as slough. S-L-O-U-G-H, slough. Look it up, please.
S-O-U-G-H.
S-L-O-U-G-H.
S-L-O-U-G-H.
Somebody read, please.
Slough is essentially the byproduct of the inflammatory phase of wound healing, compromising by fibrin, leukocytes, and dead living cells, microorganisms, and proteinuses, material.
All right, so basically we said that you got an infection when you have that depth, and the infection going to cause this purulency and the development, the deadening of these tissues, and that becomes slough. Now, when a patient has slough, the wound will not heal. Are you guys with
Cannot
me?
stay because of the slough. No?
When a patient have slough, the wound will not heal. So, in order for the wound to heal, you have to have debridement. And when we talk about debridement, what?
Is that this one?
Shows you data.
The slough. The slough is usually white and green and all the dead tissue inside
Now
there.
in this stage it's gonna start healing, right?
No, listen to me, listen before you look at that.
I think that gets worse.
You have the ulcer, stage 3 or 4. You have the slough. If you look at an image, look at the slough. Look at the slough, don't look at anything else. Don't look at it without the slough, look at it with the slough.
That's what
And when the patient has slough, you have, no, I want to look at decubus ulcer. That's not decubus ulcer, that's look like a leg. All right.
Mr. West, it also says here that until enough slough is removed to expose the base of the wound, the true depth and therefore stage can be determined.
Right, you see the stuff? The dead tissue? Correct. So you have that dead tissue inside there. And what they will do, you have three things to be done. And this is called debridement. And you have three types of debridement.
Mechanical.
One, you have the one that we call wet to dry dressing, WTD. That's mechanical debridement. You're going to see at times when you dress a patient, you have to put some saline on it, or else you can't take the dressing off. That's wet to dry dressing. The mere fact that you pull it off, you're taking out the slough with it. That's mechanical. The second is enzymatic. Enzymes are used now to destroy the collagens. It's also have something called collagenase is one type. They will eat away. And the third type is surgical, where the doctor or the wound care nurse will use a scalpel to cut away the dead flesh or the slough. Because once you have a slough, it's not going to heal. And what now they're also using for debridement is that they're taking worms. The worms are the larvae of flies called maggots. And they take these maggots and they put them into their wound. And the maggots will now eat the dead flesh. They don't eat the good flesh, only the dead flesh. And they're very effective in cleaning the wound out.
Is that painful for the
I have seen
patient?
this one.
I don't know.
Also give them some kind of
Surgically, I think.
anesthesia.
Surgically.
There's some kind of
But with the maggots in it? They
Of
put
course,
it-
you gotta close it up with the dressing
anesthesia.
to make sure that they don't just crawl out and crawl in the bed and all over the place.
Localized
I don't know if
anesthesia.
any of you have ever seen human beings with these worms.
I seen the movie.
I have seen people with it, and not, these are ones that develop in human beings.